You wake up every single morning and the first thing you do, before coffee, before anything, is clear your throat. That thick, stubborn feeling is already there, waiting for you, like it never left, because it didn't. You've tried the teas, you've tried drinking more water, maybe you've tried those syrups from the pharmacy that promise relief on the label, but do absolutely nothing once you open them. And the frustrating part isn't just that nothing works, it's that nobody seems to have a real answer for you. Your doctor says it's allergies, someone else says it's just age, and you're left standing there, clearing your throat again, wondering if this is just how the rest of your life is going to feel. I want you to know something before we go any further. This is not normal, this is not just aging, and you are not stuck with it. I'm Wesley Harper, and today we are going deep on one of the most common complaints I hear from adults over 60, that persistent mucus and phlegm that just will not go away no matter what you try. We're going to talk about what's actually causing it, why the usual remedies fall flat, and what genuinely makes a difference. Stay with me because some of what I share today is going to completely change how you think about this problem. And if you're new to this channel, welcome. Hit that subscribe button so you don't miss what's coming. Now, let's get into it. First, let me clear something up right away. And this part is important. Mucus itself is not the enemy. I know that feels hard to believe when you're dealing with it every day, but your body produces mucus on purpose. It's part of your defense system. Every day, your body makes a significant amount of mucus to trap dust, bacteria, irritants, anything that tries to get into your airways. It keeps your throat and nasal passages moist and protected. It's actually a sophisticated, well-designed system. The problem isn't that your body is making mucus. The problem is when that mucus becomes thick, sticky, and impossible to clear. When it stops flowing the way it should and just sits there, heavy and uncomfortable, in the back of your throat. That shift, from normal protective mucus to that stubborn, dense phlegm, is a signal. Your body is telling you something is wrong. And what's wrong is almost never what people think it is. So let's talk about what's actually going on. The number one cause of persistent phlegm in older adults, and this is the one that surprises almost everyone, has nothing to do with your lungs or your nose. It starts in your stomach. There's a condition called silent reflux. Most people have heard of acid reflux, that burning sensation in the chest after eating. But silent reflux is completely different, and the reason it goes undiagnosed for so long is that most people who have it feel absolutely no heartburn at all. No burning. No obvious indigestion, nothing that would ever make them think their stomach is involved. That's why it's called silent. Here's what happens. Your stomach contains powerful acid that's essential for digestion. Between your stomach and your esophagus, there's a muscular valve that's supposed to stay tightly closed after food passes through. But as we get older, that valve can weaken. Certain foods, stress, carrying extra weight, or eating too close to bedtime can all cause it to relax when it shouldn't. When that happens, especially while you're sleeping and lying flat, a fine mist of acid can travel silently up the esophagus. You don't feel it. There's no burning, no discomfort, nothing that wakes you up. But that acidic mist reaches the back of your throat, your larynx, your vocal cords, and these areas are extremely sensitive. Unlike your stomach, your throat has no protective lining against acid. So night after night, that invisible mist causes repeated low-level irritation, a slow, quiet chemical burn that most people never connect to their stomach. Now your throat, feeling that repeated irritation, does the only thing it can to protect itself. It produces a thick layer of mucus as a shield. That phlegm you wake up with every morning, that's your throat trying to protect itself. It's not the problem. It's the response to the problem. And here's why nothing you've tried has worked. Every tea, every syrup, every remedy, they were all aimed at removing that mucus. But your throat kept making more because the irritation never stopped. You were pulling away the shield without stopping the attack. There's also something specific happening that most people never hear about. When acid rises from the stomach, it carries with it an enzyme called pepsin. Pepsin's normal job is to break down proteins in food. But when it gets deposited in the throat tissue, it just sits there, dormant, waiting. And what wakes it up? Anything acidic that touches your throat, your morning coffee, orange juice, a soda, Even something as simple as lemon water. The moment anything acidic hits your throat, that pepsine activates. And since there's no food for it to break down, it starts breaking down the tissue in your own throat. Your body panics and produces more mucus to protect the area, more phlegm, more clearing, more frustration. The cycle goes round and round. Let me know in the comments if this is making sense to you, because once you understand this, the path forward becomes so much clearer. Now, silent reflux isn't the only cause. There's another one that quietly affects a huge number of older adults, and it's one most people never consider: chronic sinus drainage. And I don't mean the dramatic kind with headaches and severe congestion. I mean the mild, almost invisible kind that older adults deal with silently. What happens is this: while you sleep, your sinuses slowly drain down the back of your throat. Just a quiet, steady drip. You don't feel it happening. But by morning, that mucus has been sitting in the back of your throat all night, and that thick, uncomfortable feeling is already there before you even get out of bed. Most people assume this is a lingering cold. They head to the pharmacy and grab an antihistamine, one of those over-the-counter pills that dries everything up. And while it might give them a brief feeling of relief, what it's actually doing is making the mucus that remains even thicker and stickier. You end up with less mucus, but harder mucus, the kind that's even more difficult to clear. The right approach here isn't to dry things out, it's to rinse and thin. A simple saline nasal rinse, warm water with a small amount of salt, done morning and night can make a remarkable difference. It cleans out the sinus passages, reduces inflammation, and keeps the mucus thin enough for your body to clear naturally. This is one of those habits that sounds too simple to matter, but people who do it consistently are genuinely surprised by how much better they feel. Now here's something that doesn't get talked about enough, and for older adults especially, this one is really worth paying attention to: your medications. Many of the most commonly prescribed medications for seniors can quietly contribute to persistent throat mucus, and nobody connects the dots. ACE inhibitors, which are widely used for blood pressure, have a known side effect of increasing a substance in the body that triggers a dry, irritating cough. That cough, repeated constantly, generates more mucus and makes the throat more irritated. Many seniors have been told this cough is just something they have to live with, but it's actually a medication side effect, and there are alternatives worth discussing with your doctor. Anti-inflammatory medications, the kind often taken for joint pain, can also be a contributing factor. They work by reducing certain protective substances in the stomach lining, which can make silent reflux more likely. So if you're taking something regularly for arthritis or joint discomfort, and you've been dealing with persistent throat mucus, it's absolutely worth bringing up with your doctor. Not to stop the medication, never stop or change medication without talking to your doctor first, but to have a conversation about whether there's an alternative that might work better for your stomach. This is something so many seniors never think to ask. They deal with the phlegm and take the joint pain medication and never realize the two might be connected. Stay with me, because what I want to share next is the part that actually gives you something to do about all of this starting today. Let's talk about what genuinely helps. The single most impactful nighttime change you can make, especially if your symptoms are worst in the morning, is to elevate the head of your bed. Not just an extra pillow under your head. That bends your neck and can actually make things worse. What you want is to raise the entire upper portion of your body. You can do this by placing something solid under the legs at the head of your bed: thick books, wooden blocks, or a wedge pillow designed specifically for this purpose. Even a small incline makes gravity your ally while you sleep, keeping stomach contents where they belong instead of allowing that acidic mist to travel up toward your throat. People who try this are often genuinely surprised by how much better their mornings feel within just a couple of weeks. Same bed, same room. Just a small change in position that makes a big difference. The second thing, and this ties directly into the silent reflux issue, is what I call the 3-hour rule. Finish eating at least 3 hours before you go to bed. When you eat close to bedtime, your stomach is full and actively producing acid right when you lie down. That's when reflux is most likely to occur. Giving your body 3 hours to digest before you sleep removes a major trigger. A lighter dinner, earlier in the evening, eaten calmly rather than rushed, This one habit alone has helped a lot of older adults see real improvement in their morning symptoms. Now let's talk about what you're eating and drinking, because certain things directly trigger that pepsin activation we talked about earlier. Coffee, especially on an empty stomach first thing in the morning, is one of the biggest culprits. Carbonated drinks of any kind, anything with tomato, citrus fruits and juices, vinegar, spicy foods, chocolate. These don't cause the reflux on their own, but they absolutely reactivate the pepsin that's already sitting in your throat tissue. You don't have to give all of these up forever, but for 3 to 4 weeks, pulling back significantly on these things gives your throat tissue a real chance to calm down and begin healing. Some people are amazed at how much their symptoms improve just from this one change. Hydration matters here too, but in a specific way. When you're even mildly dehydrated, mucus becomes thicker and harder to clear. Your body simply can't keep it thin enough. Warm water throughout the day, not ice cold, not large amounts all at once, sipped steadily between meals rather than during them. 2 warm glasses first thing in the morning before anything else is an excellent habit. It thins the mucus that built up overnight and gives your throat a gentle, natural rinse before you eat or drink anything else. There's also a simple gargle that can help first thing in the morning. Half a teaspoon of baking soda in a glass of warm water. Gargle for about 30 seconds and spit it out. Baking soda is alkaline. It helps neutralize the acid that settled in your throat overnight and may help deactivate that pepsin we talked about. It sounds almost too simple, but people who do this consistently often notice a real difference in how their throat feels throughout the rest of the day. One more habit worth mentioning: the air in your home. Dry air is hard on the throat, especially in winter when indoor heating is running constantly. A cool mist humidifier in your bedroom keeps the air moist enough to help your throat stay comfortable through the night. Just make sure you clean it regularly, every few days with a little white vinegar, because a dirty humidifier can actually make air quality worse. Now I want to talk about something that's going to feel counterintuitive: the constant throat clearing itself. Most people clear their throat dozens of times a day without thinking about it. It feels like the right thing to do, like you're trying to get rid of the problem, but constant throat clearing actually makes things worse over time. Every time you do it, you're rubbing irritated tissue against itself. The throat responds by producing more mucus to protect the area. You clear again. More mucus. It's a cycle that feeds itself. Next time you feel the urge to clear your throat, try this instead. Take a small sip of warm water and swallow gently. Or do a soft, quiet cough with your mouth slightly open rather than that hard, forceful throat clear. It takes some practice to break the habit. But reducing throat clearing is actually one of the most helpful things you can do for long-term recovery. I want to share a quick story. There was a woman in her late 60s, had been dealing with this exact problem for nearly a year. She'd seen her doctor twice, tried 2 different antihistamines, bought 3 different syrups. Nothing made a lasting difference. The frustrating part was she couldn't figure out what she was doing wrong because she felt like she was doing everything right. When she finally looked closely at her daily routine, a few things stood out. She was drinking coffee first thing every morning on an empty stomach. She was eating dinner around 8 o'clock and going to bed by 9:30, and she was sleeping completely flat. None of these felt like a big deal individually, but together, they were creating the perfect conditions for silent reflux every single night. She made 3 changes. She pushed dinner to 6:30, she elevated the head of her bed, and she switched her morning coffee to after breakfast instead of before. Within 3 weeks, the morning phlegm had reduced dramatically. Within 6 weeks, she described her throat as feeling clear for the first time in almost a year. Same age, same health, just the right information, finally applied. Now, before I wrap up, I want to be honest with you about something important. If you've had persistent mucus or a feeling of something stuck in your throat for a long time, please do talk to your doctor. While silent reflux and chronic sinus drainage are very common causes and very manageable, there are other conditions that should be evaluated properly. If your phlegm ever has blood in it, if you've developed a fever, if you're losing weight without trying, or if the problem gets noticeably worse rather than better, don't wait. Get checked. This video is meant to educate and help, not to replace a proper medical evaluation. But for the vast majority of older adults dealing with this frustrating, persistent, everyday problem, the cause is manageable, it's findable, and it's fixable. Your body isn't failing you, it's been trying to protect you all along. The phlegm is the message, not the disease. So here's where I want you to start. Tonight, try the 3-hour rule. Finish dinner at least 3 hours before bed. Tonight, arrange a slight elevation at the head of your bed. Tomorrow morning, before anything else, drink 2 warm glasses of water, then try the warm baking soda gargle. And for the next few weeks, pull back on coffee, citrus, and carbonated drinks, and pay attention to what you notice. Give your body the chance to calm down and heal. It wants to. It just needs the right conditions. If today's video helped you, please give it a thumbs up. It genuinely helps more seniors find this kind of information when they're searching for answers. Subscribe if you haven't already. I'm here every week with honest, practical health content built specifically for older adults. And drop a comment below. How long have you been dealing with this? Did anything in today's video surprise you or click for you? I read every single comment, and I genuinely love hearing from this community. Take good care of yourself. You deserve to feel comfortable every single day, not just on good days. I'll see you in the next one. Just remember, this video is for educational and informational purposes only. Always talk to your doctor or healthcare provider before making any changes to your medications, supplements, diet, or health routine.